Thank you so much. It's truly a pleasure to be here, and it's great to see you again after so many years. That was a great talk, actually, before. I think I'm going to go see what pills she has there to offer for us. So, I mean, we're going to switch topics to intelligence and the operating room. But before that, I'd love to share a video with you.
My name is Peter. I'm from Nuneaton. I'm 70 years old, and I'm here for a partial knee replacement. For about 2.5 years, I've been suffering from pain in my left knee. They worked out that I also had arthritis, but it just seemed time to take control. I do feel safer overall, things being recorded.
My name is Simon Jennings. I'm an orthopaedic surgeon and I work in northwest London. And now that we have the Proximie system, we've got a valuable vault of information in terms of operations that we carried out, which we can use for teaching purposes. And the video actually allows you to talk to people who are not in the room, who are either in a different country or in the labs. Fundamentally, what I've been using before is not as good. And as such, I've been using robotics for all my surgeries, including primaries and revision joint replacements of the knee.
I think Spire Hospital looked after me really well. I thought that it would be a lot more painful than it has been. The surgery went really well, and the fact it was recorded and therefore people can learn from that is reassuring in itself. I expected just to have one camera and one picture, but to watch 4 things happening at once was a really interesting thing. Truly, after 3 weeks, I could do most things. Thinking about the future, I feel very positive. If I had surgery again, I wouldn't hesitate to ask for Proximie to be there and help with that journey. I think it's been quite liberating to take control and get my life back.
So I hope what you would have taken away from that video is more than just a story, although it's an incredible story, and actually that patient is the father of one of our team members of the company. But really it's the importance of how we're able to capture surgical data to make an impact for patients' lives, to make an impact around the quality of care that we deliver, and to make an impact across the continuous learning. Because as we know, in the OR, every single moment matters. Every moment today is undocumented. But if we're able to really create a mechanism that allows us to connect, to collect, and to activate knowledge and insights, it truly means we can live up to why we all chose healthcare as our calling, to deliver the best care for patients no matter where they are in the world. And I think it's fair to say our work is never done. For many of us who have chosen healthcare as a calling and as our practice, we know that every single day we're striving to elevate quality, to enhance the standards, to improve access, and to drive efficiencies within the system as well. And I think this is really ever more telling now as we think about the perfect storm of challenges that we face in healthcare every single day. And there's no doubt that technology plays an important role in that endeavor to drive that excellence. We know technology has been at the heart of the renewal, revitalization, retransformation of healthcare every single day. When I started out, and now I'm showing my age, we didn't even have medical record systems. We were using paper and pen, and EHRs were just coming to fruition. No one spoke of cloud. No one spoke of data analytics and AI, medical apps or telehealth. And robotics was just starting out, but it was more about laparoscopic surgery at this time. And so even thinking about how technology has been part and parcel of what we deliver almost feels like an old thought, but actually it is in every single thing that we do. And we have come a long way, and we're continuously striving to bring excellence. And I think for those that have built their careers around healthcare, we're starting to accept and recognize that technology, innovation, transformation, improvement are part and parcel of what we do. And it's even so much so that we're seeing curricula change to incorporate those components into the everyday teaching and training. And I think technology keeps showing us that we can unlock new opportunities and we can reimagine the delivery of healthcare. Of course, right now, and it would not be a wired health conference if we didn't have AI somewhere in the talks, but we know that we are in the throes of another technological revolution. One I think that might prove to be even more transformative and more game-changing than ever before. And of course, I'm talking about artificial intelligence. And this is not new. It didn't just start yesterday. We've been working and leveraging AI for many, many years. But I think it's become ever more prevalent and something of a hot topic really in the last 18 to 24 months. And I think it's with good reason, because we're starting to really think about how can AI really change the way we deliver care? What is the power of this incredible technology that is going to change the way we access and deliver care to our patients? Well, let's take a step back and think about the impact it's having in other sectors, what we can learn from, whether it's in automation, agriculture, factory delivery. We know today we have drones that are flying across fields of crops that are using computer vision and AI to identify what crops need better fertilization, irrigation, other nutrients. And those little incremental introductions are delivering a huge yield that has huge impact around how we deliver food to the global population. We look at Amazon and its storage capacity and what they're doing with AI robots around deliveries and storages. We look at even driverless cars and what in that future that can happen, what can deliver from that too. And so we're already seeing, even in the consumer world, serving up recommendations around what's your favorite series and what's your favorite show, whether it's on YouTube, Netflix, or any of the other mediums that any of you are using. And so we know that there are glimpses of AI that are making transformational changes in what we do in our everyday lives. So why wouldn't we do that in healthcare as well? These changes aren't just impressive, they should be instructive. They should help us really determine and demonstrate radically what we can do when it comes to efficiency, quality, and customer experience. At the end of the day, healthcare is also about the experience that you have in your journey as a patient. And I think it's fair to say we're not doing a great job at that. And we can leverage some of these innovations to do better and to deliver a better data-driven, technological-driven experience for our patients. Unfortunately, I think it's fair to say that we are facing a perfect storm of challenges. Challenges around the workforce that is incredibly burnt out, challenges around quality and safety of care, challenges around productivity and efficiency, and of course around effectiveness. And so there's an immense opportunity here to think about how we can take these learnings from other sectors outside of healthcare and translate them into the healthcare sector. How can we deliver AI for a better healthcare system? How can we bring that intersection of innovation, healthcare, technological, and academic advances to improve the quality of care? Now, this is a topic that we could spend days speaking on, whether it's from precision medicine, to genomics, to predictive analytics, to drug discovery, to medical device manufacturing, and the list goes on and on and on. But for the purposes of the last 7 minutes I have, I will focus it more on surgery because that's an area of expertise that I have. And whether we like it or not, surgery affects all of us. A study showed that in our lifetime, we will have anywhere from 7 to 9 procedures done. And they can be as simple as shaving off a mole to, God forbid, a complex cancer reconstructive surgery as well. And from my perspective, there's a lot that can be done in this space. As a surgeon practicing in this space for over 15 years, and in many parts of the world, as you heard from my intro, but also someone who's excited about technology and a founder of a surgical startup, I'm an evangelist for this. I believe there's an intersection that has to happen. But let's ground ourselves in some of the facts. As you might know, the operating room and operating theaters are some of the most resource-intensive and expensive assets for a hospital. Operating rooms run at a cost of about £1,200 per hour on average to operate. And unfortunately, what we know today is efficiency remains remarkably low. Approximately 25% of surgeries are delayed, 30% begin late or don't happen, and the operating rooms typically are running at about 60 to 70% of total capacity. Now, when you look at that, and you look at that in the face of the backlog, the patients waiting for surgery, the highly skilled staff and workforce that are in those environments, as well as the hugely expensive equipments that are in there, you question why. And unfortunately, it's because we don't understand truly what is happening in these environments. The operating room is incredibly opaque. It's an analog environment. 75% of the OR's activities remain undocumented. That is a white space. And a white space is a vast, untapped reserve of potential, a potential to improve productivity and patient outcomes. By turning these environments into connected and intelligent environments, not only can we connect the world's best expertise to deliver care to every patient no matter where they are, but we can start to leverage data to drive better training of models and algorithms that can help us do wonderful things when it comes to delivery of surgical care. This phenomenon of AI, of course, requires good data sets. And we know already as we look to ChatGPT, your Copilot, Gemini, they need a strong, robust data set to train these models. We know and studies have shown that GPT was initially trained, I think, on about 45 terabytes of raw, unfiltered data, equivalent to about 12 trillion words. And obviously it was trained on text data. So if you give these algorithms enough data, you can actually do some magical things. Now, when it comes to surgery, we know that there's no shortage of data, particularly in healthcare. Hospitals generate an immense amount of data, I think somewhere in the region of 175 zettabytes by 2025. And nearly 97% of that data remains unused. So we talk a lot about healthcare data, the NHS has a lot of data, what can we do with all this data? But we're not really using the data. It's locked in isolated, fragmented, siloed systems, not curated, not collated, not connected in a multimodal way that can actually drive the training of great models in the delivery of care. And that is the white space. Without a standardized and integrated data infrastructure, we simply cannot leverage these models effectively. And again, I talk about this in the context of surgery. This inefficiency and this ineffectiveness has an impact because inefficiency costs lives. Today, about 4.2 million people are dying around the world within 30 days of surgery, of which half of this is preventable. And it's preventable if we're able to actually capture and understand why this is happening, to look at pattern recognition, and to create real-time insight, not post-fact insights. I don't need the insights 30 days after this happened. I need the insights in the moment. I need edge AI, real-time AI, intelligence in the moment. My co-pilot in the operating room with me to help me drive better decisions that are going to influence better care for patients. This is not just an operational imperative. It is a moral imperative for all of us as well. Now, I want to make sure I'm not delivering a message that we're not doing anything in AI in surgery. We are doing a lot of things already in healthcare. We look at things like DeepMind and Google's MedPalm. We look at components around drug discovery. We look at areas around wearables and chatbots and medical devices. There's a lot of great things happening in this space as well. But I think there's so much more we can do and so much untapped potential. And we have the opportunity here to reconfigure how we approach data in a structured way. And that's exactly what we've been doing at Proximie. Think about operating rooms that are laden with equipment, devices, robots, video towers, medical record system, even whiteboards. If we're able to bring all these different components together, timestamp them, and leverage a multitude of sensory, unstructured data sets into structured data sets, this will unlock an unbelievable potential for us in terms of not just how we deliver care from a workflow benefits perspective, but the care that we deliver from decision making. And that's what Proximie is. We are the operating system for intelligent operating rooms. We sit at that intersection of devices and the cloud, and how we bring all these components together to create the best of what is possible. And what you'll see is that we're able to connect video data, ambient intelligence through voice and audiovisual components, but also bring all of this together to drive that quality of care. Not only for those in the room, and not only for those in the system, but for those all around the world as well.
The operating room is more than a room. What happens there is more than procedures. The people who work there are more than staff. Lives are restored there. Tomorrow's experts learn there. Healthcare moves forward there. Today, the OR can be even more, because Proximie is there. Proximie is the only operating system for intelligent operating rooms. Our technology empowers medtech companies and hospitals with real-time connectivity, unified data control, powerful development capabilities, and AI-enhanced insight. With Proximie, information flows in and out of the OR in real time. Data is captured and structured to create a single source of truth, and insight into patterns and practices are discovered. It's how to make everything that happens in the OR knowable and shareable so you can learn more, innovate faster, and optimize every minute. Keep the OR's promise to be more than a room by operating at full intelligence, only with Proximie.
So let me give you an example of how that's manifesting. And this is in a partnership with the US health system. We're doing the same with the UK health system. By analyzing over 700 hours of video and 10,000 data points, we were able to show that hospital that they were running at about 24% inefficiency within that operating room. We were able to show them conservatively that they added 3 cases a week, what that would mean. That was 9,000 extra procedures per year. And of course, for health systems in the US that are driven by financial revenue as well, they were able to generate $90 million further, which they could reinvest into their system and into their workforce. And we are now able to leverage this technology to drive those efficiency gains. But this isn't just the beginning. This is the future of the intelligent operating room. And so my call to you is to really think about, this is not just about technology. It's about people. It's about surgical teams and tools that enable them to operate at the best of their ability, at the top of their license. And the decisions we'll make now will influence how we drive these benefits for the future. Do we continue tolerating these inefficiencies, or do we change? And the choice is clear. Let's choose innovation, let's choose collaboration, and let's choose a future where surgery is smarter, safer, and more connected. This is not just about the future of surgery. This is
Surgery shows the best of humanity. It shows the best of human endeavor, the best of human compassion, the best of modern technology. And because of that, surgery is changing every day. And Proximie is helping power the new era. We bring data and knowledge together. We connect, analyze, and improve operations in real time. We help make surgeries safer. So, what does that look like? Lives transformed. Life-changing moments. Lives that are lived. But know that our work is never done. Turn on Proximie. This is surgery.
Thank you very much.
Thank you so much for that. So surgery is extremely complex. It's an extremely complex human skill. I guess there's as you start applying AI to that setting, there will be case studies where you start. So what do you think will be the first application in terms of surgeries with an AI assistant?
I think it's a great question. And of course, surgery is a lot about pattern recognition as well. Generally, what you would see today, and we talked about the leveraging AI for the non-clinical use cases, so for operational use cases, because that's a low-hanging fruit. That is very easy to encourage healthcare teams to adopt. So we're looking at things like OR workflow, efficiency, codification of op notes, coding, all those things which today, we see staff spending 30% of their time doing administrative input. Now with Proximie in an operating room, it's all happening automated. No nurse has to go to a computer and click case started, case finished. You finish your case, the op note is done, you just approve it. You can get the coding. So those are the non-clinical lower hanging fruit, and that is where we're seeing early wins, because it's about behavior change. You want people comfortable with adopting these innovations. Yeah. But in parallel, we're doing a lot of leveraging of that same technology to look at clinical use cases. So when we think of any operation, today probably there's 17 ways that people are doing it. But in essence, really, there should be about 3 to 4 ways to do an operation. There's only X number of ways to do a carpal tunnel. You make a cut, you get down to, you release the pressure. So what we're looking is at pattern recognition, phase segmentation of cases, trying to automate components. And within that, we will see components where autonomy will be part of surgical process, things like closing a wound, plugging 2 vessels together, where you start to have that co-pilot in the room with you. And we already have prototypes where we can start to talk to your co-pilot in the OR. So I can say, hey, Proximie, can you pull up the latest scan for this patient? And you will start to look at patterns where it might say, because we have a plethora of, we have like hundreds of thousands of surgical video data on the platform today. If we start to look at those patterns, we can start to suggest things to users. So we can say, Nadine, 80% of users might go left here, go right. If you think about, the GPS or, Waze or any of those components. So those technologies are happening, and we have prototypes, and we're sort of bringing them to market slowly but surely. But I think autonomy or, automation alongside that human device interface will become ever more intimate, and it's an exciting sort of, revolution. The final bit I would say is, we've talked a lot about the operating room, but the work that we're doing also through partnership is what happens in the perioperative journey. So by using what we've shown with Proximie, you can start to nudge and create nudges through the process. So the ward knows that the case is finishing. They know to get the bed ready in recovery, the patient's going to get done. Today what happens is the ward calls the OR, hey, should I get the patient ready? The recovery are waiting for someone to call them to tell them we're done. This is all still happening on the phone. This can all be automated and drive that workflow, which undoubtedly comes back to patient benefit. More patients get the care they need, the workforce are not exhausted, they get home on time, and we get an objective source of truth of what's happening.
You mentioned something quite interesting, and something you mentioned before COVID, for instance, was a big change in the way people start adopting Proximie, right? Behavior change, as you said. Is there a behavior change also, a big behavior change mindset required? I mean, people still say worried that the co-pilot will hallucinate during a surgery or something. Is that something that you still need to persuade?
Yes, I mean, look, surgery is anchored in tradition. You know, we like to do things the same way. You go back to the history books or pictures from like Mass Gen in the 1800s, you know, it's still around the 3 C's, you know, how we connect, collect, and act. You know, we stand around an OR, you know, we talk to each other. There is a human element to it. But I think times are changing, and that perfect storm that I talked about is forcing that change. Now, as with all things, you'll have your early, you know, drivers, like, you know, the crossing, you'll have your early adopters, and that was happening during COVID. And I think now we're starting to see health systems. I mean, what has been the most transformation, I think, for our business, and we tripled our footprint last year, and we doubled our revenue, was because health systems are starting to understand. It's not just about surgeons getting excited about it. It's COOs, CFOs, CEOs of hospitals realizing that the digital transformation of the OR has to happen now to drive an effective use of that space for patient care.
Just a final question. So surgery is a field of human endeavor where you have the top star surgeons. I mean, the Proximie was basically to connect those
Correct.
surgeons who can only do that certain operation with someone who can access that. Do you think in the future you envision having an avatar of the top surgeon in a particular type?
Yeah, it's a great
specialty?
question. I mean, look, what's been great is even so far with what we've been doing, we're able to train twice as many doctors and nurses in half the time. But there is a workforce challenge. You know, we have, you know, billions of people needing surgery. And so there is a time zone issue. You know, you can't all be in any operating room on time. So there will be a future where automation and pattern recognition will start to create those nudges. You might not need a human on the other end of the line. You might need a system that is making suggestions to consider. And we hope that again, will go back to fundamentally what we're trying to do, which is, you know, 2/3 of the world's population lacks access to surgery, and we need to make a difference there.
Great. Nadine, thank you so much.
Thank you so much.
Always a pleasure. Thank you.